So we've been trying to be as responsive as we possibly can. But again, seeing as we're coming on the end of that 70 plus list, and we have a really big publicity campaign going out this week as well. So we want to make sure that we are providing as many opportunities as we can to our public while we still have our larger clinics available.
Katie, just to follow up on providers where people could locate other providers besides public health, is that at the shinyapp.com, or where can they go to find those providers?
No, we're working on adding that just actually to our website. Shiny is the state's app. It's only available to public health.
Okay.
So it isn't publicly accessible. I can tell you providers right now in Montrose County that as of 5 o'clock today will have vaccines available, would be City Market. Both of our City Market locations here in Montrose, and again, they are part of state and federal allocation as well. Our Safeway pharmacy here also will have vaccine. The Pick Place will have vaccine. And then in the West End, the Basin Clinic as well.
What looks like that's pretty much the questions. Anything else you'd like to say? Oh, the website at Montrose County JIC has disappeared with all the numbers. Do you want to explain people that you can't work 24 hours a day?
Sure.
And that might be a good thing to add. So.
Yep. No, that's a great question. I've had it a few times. So in standard county operations, so I do handle all of our public information. It's actually myself and our digital communications manager, Erica Story. And it's the two of us, and we manage about 16 different social media accounts and 12 to 14 different websites. That's in a given day. That's not a pandemic. So in a pandemic, as you can imagine, much of our attention and efforts were focused on. Erica built MontroseCountyJIC.com. I do want to give her a shout out because she's just a tremendous asset to the county. She built that site in a matter of less than a week. So it saved a ton of money having that talent and that staffing in-house. So you're probably referencing the dashboard, and that's a group effort. It really was a wonderful tool. The dashboard was a list of our local data. When we moved to clinic operations, and that's something that we've been focusing on very much, we really have just had very limited time. The other challenge that I think is important to note here, and I'm not, the other challenge, I'm trying to think of a really nice way to say this. The other challenge we have is frankly just in the state. So on February the 5th, was a Friday, was I believe one of our last days of reporting on our dashboard. At that time, we were still having cases being added in back through January 28th by the state. And so that got incredibly hard to track. We also had deaths that were being added after the fact. And so again, those were not things that were occurring, just we had been reporting out on a given day. And at that point, having to go back that far and try and reconcile and figure out which cases were being added because they weren't identified in the system, that got incredibly hard for the team. And we felt like that was a really good point to kind of put a pause on things, to turn to the state data. We know and acknowledge it's not as robust, but we hope that our community members will understand and agree that our vaccine efforts are definitely our top priority now. And so we are looking at trying to put up a vaccination dashboard so that we can see all of those numbers as well. And we're hopeful we'll have that up soon. And trying to find a solution for the interim, but ultimately we're still referencing state data right now.
And for those of you that, I'm going to let Katie really jump off this time, but for those of you who have questions, just so you know that I'm available, my email. I mean, I can funnel those through. If you don't get an answer at Public Health, trust me, the phone is right behind me, that one of the phones that's being forwarded, and I hear it all day long. I was here yesterday and I heard it the whole time I was here. I think that we're dealing with a population that if you don't get an answer, you keep calling. So I don't know if it's the same person over and over again, but I will tell you that we're busy here. We've hired at least four temps to help with the workflow. So it is, and that's not for anybody to feel, I'm not trying to elicit any pity here. I just want you to know that we are responsive to the needs that occur as they occur. And as Katie indicated, this is a total moving target. What I might tell you yesterday will not be what's true tomorrow because something changed. The state is in constant motion, and probably because they're in constant motion from the federal government. So it's going to be, we're just being responsive as we need to be. So Again, you can call me, Sue Hansen, Montrose S. Hansen at montrosecounty.net. I talk to everybody. I get yelled at a lot, and I am getting used to it. So if you have any questions, I'm happy to funnel those to wherever they need to go. So Katie, anything parting that you'd like to say before we let you get back to work?
Yes, I see, Dr. Joe, I think you were adding the contact tracing question, right?
Mm-hmm.
That was another thing that we, I will say more or less at that point, pushed the red button on and was transferred to the state. Again, prioritizing those vaccine efforts. I mean, I'd like to thank the team. We have an amazing team that is doing the best that they possibly can to provide vaccines as quickly, as efficiently, as effectively as we can to our community. It's refreshing to be on some of these regional calls and know that Montrose County is by far and away the lead in distributing within our region with these efforts. We have a great system. We have a great team. We appreciate the public's patience. I would make a plea for our 65 plus. If you qualify and you're interested in vaccine, if you have friends, if you have a neighbor that maybe has challenges with the internet, if you'd be willing to kind of continue that sense of community spirit that we had going into this pandemic. So go a step beyond, you were buying the groceries, helping them to stay isolated, help them get signed up to get a vaccine to provide the protection that they need moving forward. And, ultimately too, we started our pandemic with my PIO hat on, all of our posters around town of like community strong, and we will get through this together. And I think we're at a point where we're finally starting to see a little bit of the light at the end of the tunnel, and we're looking forward to that time.
Great. Thank you, Katie. Appreciate you jumping on the call with us today. And hopefully that clarifies the situation for some people about what's happening and how it's going to happen and how it will roll out. So thank you very much for joining us. And now I'm going to turn it over to Dr. Joe so I can start answering chats. And Dr. Joe is the supreme multitasker here. So Dr. Joe, again, he's been a lifesaver for us, and I will turn it over to you to talk a little bit about the myths and sort of where we are now and where we're going to go. So take it away there.
Okay, thanks everybody. And yeah, big thanks to Katie. She's done a wonderful job with our vaccine efforts, and she and Jim Austin, our public health director, have really, I think, been a shining example of what can be done when you put the right people in the right place with a mission like we had, which was to save lives and save jobs. And their task force was obligated to get the most number of vaccines out in the shortest amount of time. And they've really done that. I suspect by the end of the month, we'll probably have 10 to 12,000 people who have received at least one dose, which, if you think about it, is a very large percentage of our county population. And so big thanks to her and her efforts. And in terms of where we're going, I suspect that our community providers will begin to outpace the ongoing demand for vaccines in about 3 weeks or so. And what I mean by that is that as we continue to enroll more and more providers, and they continue to get additional allocations from both the state and the federal supply chain, we expect to see 1,500 to 2,500 doses per week in capacity, in distribution capacity amongst those partners. And at the same time, we will see that the backlog of interested residents of Montrose will begin to come down. And so at that point, we will, in public health, step back and support those community providers in their operations for a few reasons. One is that we are pulling resources from multiple agencies, as you've already heard. So it includes county government, school district, fire department, hospital, et cetera. And those people have other jobs and other obligations that they're doing that they're largely putting on hold to make sure that our community has a good shot at beating this pandemic. And so we are fully committed to that. But at some point, the need is just not going to be there when our community providers can take care of it. And it will further the distribution chain so that you're not limited to 1 or 2 days a week in one location in Montrose City. Rather, you can see a provider in Basin Clinic and get a vaccine, or a pharmacy within Montrose City limits, or maybe in Olathe, et cetera. So we want to distribute the vaccine across the county with as few barriers as possible so that people who want them can get them. I'll speak for a moment about some of the myths about the vaccine. There's I guess, 2 that I hear are probably the most common. And they sound ridiculous on surface. So I mean, I hope that no one here takes this very seriously, but there are folks in our community that are legitimately concerned about nanochips being in the vaccine and that you will then be followed for the rest of your life. That's just not true. Having been able to peek inside the workings of government for the last year, I can tell you that the group couldn't get, and I mean this as a nation, not as a Montrose County, they couldn't get enough toilet paper. They couldn't get enough masks. They couldn't get enough of anything. And so for them to have had nanochips would be quite impressive. And then what would be more impressive is that only one would go in each person. Since it's in a multi-dose vial, you would have to have it somehow suspended in a way that you only got one per shot. And then here we are screwing up the plan because we're pulling an 11th dose out of the vial. And so at least 1 in 10 are not getting the nanochip. So we'd have a lot of upset people. Not only that, but of course, all of you know that if you have a phone, you're already being followed, by data trackers that way. Most of us have a birth certificate, we pay taxes, we have vehicle registrations, on and on and on. So we all know where you're at. And I mean whomever that would be that's so interested. Not only that, but you probably are tweeting or putting on Facebook every time you're going to eat a meal, and some people when they're going to the bathroom. So the nanochip thing just seems silly on its face. I heard one though that was concerning to me. It was fairly new to me a couple of weeks ago, but a person told me that they weren't going to get the vaccine because it is made with aborted fetal materials. And that is just not true either. I would be a little bit rude, but I mean, this person I was speaking to had been around America quite some time. I asked her to set common sense up and see if that made sense. And it didn't really make sense to her in her nearly 80 years of experience in America that a vaccine would require aborted fetal tissue, especially in a pandemic like this where we're trying to get everybody in the world vaccinated. There's probably not enough aborted fetal tissue to do that. But the other more interesting thing is the ingredients are public. You can look at the ingredient list yourself. It's actually very short for these vaccines. There are 4 lipids. There's the mRNA strand, there's sucrose, there's water, and there's 3 stabilizers. One's a pH buffer and the other 2 are stabilizers. It's very simple. It's a very, very simple vaccine in terms of what ingredients are in there. And so I encourage this person, and I encourage anybody listening that might have some of these concerns to go to the public websites that are credible and to research it yourself. You can actually read the phase 1, 2, and 3 clinical trial reports that came out of these studies for the various vaccines. You can look at the FDA, the committee reports when they evaluated the data. And so I hope that people will take the time, instead of reading a blog post, maybe they'll read the actual evidence themselves. Or if they don't know how to read the evidence, it's not expected that we all know how to read phase 3 clinical trial reports, but you can certainly go to more reputable sites, CDC, CDPHE, MontroseCountyJIC.com. The American Academy of Family Physicians site, AAFP, also has good resources for people, and those are trustworthy organizations. Another rumor that I think is really helpful to review, because this is a legitimate concern by our childbearing age women, is that if they get the vaccine, they will be sterile, or they'll harm their placenta if they're already pregnant. And that is unfortunately stimulated from a blog post on a money magazine. It's amazing how powerful some of these conspiracies can overwhelm legitimate news information sources. At the time that blog post came out in late November, there were already known 42,000 pregnant women who had contracted COVID infection. So if we think about this, if you're infected and we know you build antibodies, and those antibodies that you build are to spike proteins and to other components of the virus. And then if we say, well, the vaccine gives you antibodies to spike protein, well, your body makes them, but you eventually get antibodies to spike proteins, the same thing that you would get if you were naturally infected. Then wouldn't we have expected those women who were pregnant at the time of their COVID contraction to have placental damage, maybe even harm to their fetus and to the pregnancy? That's where I would go for the data. I wouldn't go to a money magazine blog post. And that wasn't seen. In fact, to my knowledge, at that time, over those 42,000 cases by late November, there was not any adverse reactions to the placenta or to the baby directly related to the mother's immunity that they generated from the COVID vaccine or COVID infection. And so the unfortunate part about that rumor was it took a little piece of data and ran with it. The theory at that time was that there's an amino acid sequence in the spike protein that mirrors or that is the same as the amino acid sequence in a placental protein. But when your body's immune system builds an antibody, it looks for the gross shape of the object. So in this case, we'll use my coffee mug, and the antibody comes in and it says, if my grip is made for that coffee mug, I will then be able to attach to it, and that's how my antibody will work. The antibody does not disassemble the coffee cup to look at the amino acid sequence to see what it's made of. It's looking at it more of a tertiary level. And so there may be some shared amino acid sequences, but the protein folding doesn't end up being the same. And therefore you don't see the same antibody reaction to the spike protein found on viral particles of COVID as you would a placental protein that has a different shape, but a similar amino acid sequence as part of its makeup. So that was the third rumor. And the American College of Gynecologists, the American Academy of Family Physicians, the World Health Organization have all come out and recommended vaccination for pregnant women. Now, the World Health Organization sat on the sidelines for a little while. They weren't really that quick to recommend it, but ACOG was, which is a very reputable medical organization. And so I encourage pregnant women to get the vaccine. It protects them, it protects their baby, it protects the people that they're around. I guess that brings me to another thought, Commissioner, which is, does my getting vaccinated protect you? This was an interesting conversation that was occurring on some of the social media posts. I try and avoid those, but I sometimes am briefed on what's going on with those. And the CDC is kind of hedging on this, and they're saying, well, we don't have enough data. We don't know. And you've heard that a lot during this pandemic, right? We don't know how long you'll be immune if you have vaccination. We don't know how long you'll be immune after you've recovered. We don't know what it means if you test positive for antibodies. So there are a lot of unknowns. And I think that's reasonable for our leaders in public health, mainly CDC, to be cautious in their recommendations. But if you're wondering, if I get the vaccine, does that actually protect other people? The answer is most likely yes. More time will tell whether that is true or not. But I'll take you back about 11 months. So China had been working with COVID a little bit longer than America had at that time. And so some Chinese researchers did a study. Now, these are on monkeys. They're not humans. And that's, we need better evidence. But this is kind of an interesting study. They took some monkeys and they infected them with COVID. They killed one of the monkeys and they basically did an autopsy to see where the virus was in different organs. And they found that it was fairly ubiquitous in the body. It got to a lot of different tissues. So then the remaining monkeys, they tested them and they recovered and they got antibodies, natural antibody production. And once they had natural antibody levels, about 2 weeks later or so, they re-inoculated them. They tried to reinfect those monkeys with COVID virus. And what happened was they got a low-grade temperature for about a day, and they were never able to grow the COVID-19 virus out of their nasal passages. And so the theory at that time was, once you have those antibodies, you were able to prevent an infection and prevent basically becoming a host that would then be able to spread it to other people. They weren't able to grow it out of your nasal passages. So that's a study on monkeys. We need more robust study, and we will get that as time goes on. And we have already had so many people across the world that have survived from COVID. And once we're out of a pandemic level where there's so much high prevalence, where we really don't know where people get it, they could have gotten it from the grocery store, they could have got it from work, or they could have got it from their neighbor. Once we're out of the pandemic phase, I think we'll have a better understanding of how the transmission occurs. But my suspicion is that once vaccinated, you are either will not transmit it to somebody else, or your risk is significantly reduced. Because we have to remember that when you transfer a virus or bacteria to somebody, it doesn't automatically mean they're going to become infected with it. There's a minimum viral load that person has to be exposed to get them sick. So if I take one little virus particle and I put it in your nose, that may not get you infected. But if I take 1 billion of them and put them in your nose, you might get infected. And so for all the different illnesses, infectious diseases out there, there is going to be a different inoculation level, and it's going to be dependent upon your own natural immunity. Are you hydrated? Do you have a bunch of cracks in your nasal passages because you're using medications or you're dehydrated? Are you otherwise immunocompromised and you don't have natural protections? All of those would play a role in it. And so if you're on the sidelines because you don't really worry about yourself getting COVID and you don't really think it will help prevent you from spreading it, I think you'd be wrong. I think that it does help decrease the spread, and you'll be part of the solution by getting the vaccine, even if you're on the side saying, I'm young, I'm healthy, I'm tough, I'll be fine. I think you should still get the vaccine. I think it'll still help you. And if we look to the leading causes of death in America, I think it's striking when we see that in 2020, I believe once the data is fully analyzed, COVID-19 will be the third leading cause of death, second only to cancer and heart disease. And I think as a doctor, we have underreported COVID deaths. So I think we probably have more than we know. We have more cases than we know. If you look at Montrose, we're reporting something like 3,200 people have had COVID. I can assure you we have had far more than that. I haven't looked at the modeling data for about 10 minutes, but let me see. So where we would project, where we'd be at on projections. So as of today, probably around 15,000 in our service area. Now the hospital service area is a bit bigger than Montrose County. So if we look at that, we're probably around 11,000 to 12,000 people in Montrose have had COVID. We only know of about 3,000.
So we could actually then say that those that have had COVID and have antibodies, presumably, and those that have also been vaccinated, that actually increases our coverage for our community, right?
Yes, absolutely. So it's not that we need 75% of people to be vaccinated to see a benefit. We need 75% of people that have immunity. The problem with natural infection is it's thought that you build less robust of an immune response with a natural infection in this case than you do to the vaccine. And that's a little bit unusual because that's not always seen, but there's some theories out there about why that might happen. But one of them's mask. If we're wearing mask and we're getting a lower viral load initially onto us, we don't build as strong of an immune system response to it. That's a theory. But the point is that the CDC is recommending those people who have already recovered to go ahead and get vaccinated again. They can wait that 90 days as we talked about, because people who got the vaccine seem to be showing higher antibody titer levels, higher concentrations in their blood than people who survived a natural infection. And if you have higher antibody levels, it might last longer for you, that you'll have some immunity. One last interesting point about antibodies, though, is that just because you don't have antibodies does not necessarily mean you're not immune. After SARS-CoV-1 back in 2003, which you guys may not have recalled because it really was not a worldwide problem. It was constrained to the Southeast Asia area. But in SARS-CoV-1, they were able to measure antibody levels for a couple of years after people recovered from natural infection. But they were able to prove that in a lot of folks, there was still memory cell function out 8 to 10 years later. Memory cells are kind of like the detectives, and the antibodies are kind of like your police officers. So in your detective room, there's going to be a picture of the bad guy. In this case, it's COVID. The police maybe have forgotten all about that bad guy because they've moved on and they're working on other things. But when the bad guy shows up again, the detectives are going to look at the picture and say, hey, that's the guy. Send out an APP to all the officers that were looking for this guy. And now we've got more antibodies again. So it's possible that we actually may see 10 years worth of immunity. We just don't know. And somebody asked me, like, so, what do you mean we don't know? Like, how are we going to know how long we have immunity to COVID? I mean, to the vaccine. And the really sad answer in 2021 with how smart we are as people is we're just going to have to find out. We're going to find out the hard way. We're going to get everybody vaccinated as much as we can. And then we're going to basically see when there's a recurrence rate of infection in those who have previously been vaccinated. It's not really that much more sophisticated than that. I wish it was. And maybe somebody will come up with a computer model about it, but it'll just be a model until it's proven. If I can take you back to the mid 90s, pertussis vaccinations were changed from a whole cellular pertussis vaccine to an acellular pertussis vaccine. Instead of giving the whole bacteria, grinding up in a blender and giving you a shot, they just picked a couple of proteins off the surface. Well, what happens in around the early 2000s? We had pertussis outbreaks, 2004, 2005. And so the CDC tracked it back to, oh yeah, that happened to those people who got that new fancy acellular pertussis vaccine 10 years ago. And that's how they found out that acellular pertussis vaccination only gives you about 10 years worth of protection. And so we are going to be learning about this for years to come. But right now we have had so many people recover, Commissioner, that we actually hit a tipping point. The reductions in hospital demand right now are not because of the COVID efforts. It's actually because we had hit a tipping point. We had so many people that had recovered that the number of susceptible individuals running around in our community dropped by 12,000 people. And then you couple that with public health measures like distancing and mask use and limited occupancy loads. And we basically just hit a tipping point where case spread started to slow, prevalence started to drop. But the nice thing about the vaccine is it'll allow us to protect those most vulnerable. That will save lives because it's, for example, our nursing home residents, they're not going to the bar on Friday night, at least not most of them. I think there might be some. And yet they're getting it from their vendors that are coming into the building or the employees, not with any malintent, but those people who are living their lives and doing their normal activities with some level of protection come into the facility to take care of our loved ones. And that's where our most at risk are getting it. So to get them vaccinated gives them great protection. But the other thing it does for the rest of us is it allows us to start to return back to a normal life. We can remove some of the public health limits without risking a surge in hospital demand. Because you remove from your susceptible numbers those people who have been vaccinated and who it works with. Remember, the vaccine's not 100%, you guys. And so I see these scare headlines come up on national news, which is always frustrating to me because they're like, oh my gosh, a family of 4 contracted COVID after the vaccine. And it's like on national news. And so you know what my response is? So what? The vaccine was never reported to be 100% effective. It was 95% effective. If we're going to go out and give 52 million doses, which is what we had given as of last night, take 5% of that and they didn't have any immune response to it. They're still at risk. And maybe even more, maybe less. That was all based on phase 3 clinical trial numbers. Remember, there's only about 30,000 people that finished less than that, about 27,000 people that finished Moderna's phase 2 clinical trial. And that's where we got the 95% effectiveness from. Now we're doing basically a study on the entire population, millions of people. So when people say the study wasn't done with enough people, I tell them, look at what's been done since the study. Since the study, 52 million doses have gone out. So if you're on the fence about risk, look to those 52 million doses and see if there has been a concerning adverse reaction.
So a question for you, Dr. Joe, is one of our participants had a recent office visit and a few of the staff had been vaccinated. Some have decided not to get vaccinated. Should he be worried as an older patient that he could be at higher risk in that medical office?
Your risk of transmission between one person to another, if they're both wearing masks, are exceedingly small. If you're not wearing a mask, if the other party is wearing a mask, and it's a low risk type of exposure, you're not necessarily coughing on each other. And let's say you're staying about a meter away from each other, 3 feet or so, your risk is just under 1% of contraction. If that person is coughing and they're sick, then your risk is going to go up. It might be 5%, depending on how long you stay in that environment. But in general, the medical offices are low risk. Their employees are screened when they come to work for temperature and symptoms. At least that's best practices. They should be. And then you're also hopefully asymptomatic if you're going into the office and seeing them in person, unless that was arranged ahead of time. And so your risk is low. I wish everybody in my medical office accepted the vaccine, and I will likely mandate it soon enough. At first, the medical community didn't want to mandate it because they felt like it was unethical. Well, I have a different opinion. I think it's unethical for us not to take the vaccine as medical professionals. We're the ones that are putting others at risk. Like I said, those nursing home residents, it's incumbent upon me not to bring it in and give it to those at-risk people. And so I sure as heck would get vaccinated to protect my patients. And you think back in history, doctors have always put the interest of our patients ahead of ourselves. And if that meant we don't see our family or we work 36 hours in a row or whatever it needs to be, we're going to be there for our patients. And what I'm seeing right now in some of our communities, medical communities, people are moving away from that. And they're saying, I'm not so sure about my own personal safety here to get it, so I'm going to wait. It's reasonable for some of those people to wait. Some of these folks have allergies that they're really concerned about, and it's reasonable for them to wait. But in general, we should be highly encouraging our medical providers, if not requiring certain settings to have it, like nursing homes. I think the staff in nursing homes should have the COVID vaccine. If you're in a cancer center, you should have the COVID vaccine. It only takes one misstep and people die. I serve at one nursing home out of Montrose County. They had COVID get into their secure unit. 7 people out of 17 died, and that was preventable. That didn't need to happen. And so I think you as an individual are at low risk going to your medical office and having a medical visit, even if not all the staff are vaccinated. Hopefully, as we continue forward, we will see more and more acceptance amongst all of our medical community for their vaccines.
Well, thank you for that. That concludes. I guess I should have recorded this. Anyway, do you have anything that you'd like for us to I guess I'm thinking about what goes forward. I mean, am I going to have to wear a mask for the rest of my life? I don't really want to. You know, I mean, what do you foresee in the future? And we have 3 minutes before we sign off. And if you could just give us a sense of what that looks like.
So I'll answer it in a few different ways. One is the Montrose County perspective. Montrose County, the government, the public health department, the medical societies do not think that you should be wearing a mask for the rest of your life. We believe that it has a purpose, it has a place, it is a treatment, it's a preventative intervention at this point, but it is not our best weapon. Our best weapon is the vaccine. It is actually, I would say, our only offensive weapon. Everything else has been defensive. Wear a mask, stay away from people. That's a defensive weapon. I want to go on the offense, get the shot, and then we can go and fight back against this virus. Then the question is going to be, what's the state going to do? The state is really the ultimate purveyor of the public health orders, and they would overwhelm anything that we would put out there. And the other thing that's more powerful is most people are rule followers. You guys have all seen this, I think, through the pandemic. Somebody of a respectable position or authority says, wear a mask. And now the social norm is to wear a mask. So when does that stop? Well, it's going to take probably an announcement from Fauci and the CDC that the mask is no longer recommended. And when is that going to happen? What they have indicated is that will not be announced until they feel like the risk of outbreaks and overwhelming the healthcare system is far behind us. And they keep saying the word 75% immunity levels. Montrose is not there yet. We're not at 75. And yet we're already seeing hospital demand going down very precipitously. We, as of last night, I was told we had 1 person in the hospital with COVID, down from a high of 14 at one point. And so we're still seeing COVID cases. There was one day where we admitted 4 last week. So it's still out there, but we are making big progress on that. And so as we continue to see that progress and we continue to feel more comfortable that the hospital is not at a place that it could be overwhelmed and that we're not going to get it into nursing homes and kill 50% of the residents, I think it's reasonable that we start to pull back and we take down the mask. We start to not socially distance, we get together. And I'm hopeful that this summer we might start to see some gatherings again, but I would not lose hope. Nobody in your local public health department or government wants you to wear a mask for the rest of your life. I hope the state doesn't feel that that's the direction to go in. And I don't think from our meetings that they feel that way either. And when we look at the national politicians and the public health folks at the CDC, they also are saying this will come to an end. So maintain hope, get the vaccine. That's how we're going to get through it faster. And then we can start pulling those masks down and getting together again.
Great. Well, Dr. Joe, thank you for your time. I really appreciate you're getting a number of comments of people grateful for the information. And I see that I should have recorded this. So Jan, we're going to have to do this again we can get Dr. Joe to say the exact same things again, we can do this. But appreciate the, yes, go ahead.
Commissioner, I actually see a recording icon in the top left of my screen. Do you see that in yours?
No,
Shh.
perfect.
Yes,
Susan,
I have most of it, not quite at the very beginning, Dr. Joe, but I have
Okay.
all of yours. So
Susan, the ninja in the back.
I'm sorry.
Business.
I was like,
Okay, so those of you who are asking about it, we will have a partial recording, and at least that'll probably get most of Dr. Joe's comments. So, Jan, do you have any closing comments that you'd like to make before we sign off?
Well, I would just like to thank everyone for their attendance. I think this was time very well spent. And we hope it's really been helpful to people who are able to attend today. We'd be with you to help put on another one, maybe at the dinner hour or another time of day when people could attend. But we really, really appreciate this great information. Thank you so much.
Yep.
This was
Thank you for everybody.
time well spent.
Appreciate it. Thank you, Jan, for that. Dr. Joe, as always, we appreciate your involvement and your expertise and your wise, sound, practical judgment. So thank you so much. Appreciate it. And I'll sign off now. Thank you, everybody.
Thank you.